Chikungunya is a viral disease primarily transmitted to humans through the bites of infected Aedes mosquitoes, particularly Aedes aegypti and Aedes albopictus. The name Chikungunya comes from a word in the Makonde language, spoken by people in southeastern Africa, which means that which bends up, referring to the characteristic stooped posture caused by the severe joint pain and arthritis that accompany the infection. Though it is mainly found in tropical and subtropical regions, Chikungunya has emerged as a significant public health issue in areas such as Southeast Asia, Africa, the Caribbean, the Pacific Islands, and parts of the Americas. Causative agent: the disease is caused by the Chikungunya virus CHIKV, which belongs to the alpha virus genus within the Togaviridae family. The virus is transmitted when an infected mosquito bites a human, but it can also be spread through vertical transmission from mother to child, though such occurrences are rare. Symptoms: the incubation period for chikungunya is typically 2 to 12 days after being bitten by an infected mosquito. Most people who are infected will develop symptoms, though some may remain asymptomatic. Common symptoms include 1. Fever, sudden onset of high fever, often reaching up to 104 degrees Fahrenheit 40 degrees Celsius. 2. Joint pain, severe and debilitating joint pain, especially in the hands, wrists, ankles, and knees. This is one of the hallmark symptoms, causing difficulty in movement and even long-lasting arthritis-like symptoms. 3. Rash, a maculopapular rash, which usually appears a few days after the fever begins and can affect the face, chest, arms, and legs. 4. Headache, a common symptom, often accompanied by light sensitivity. 5. Muscle pain, generalized muscle ache, myalgia. 6. Fatigue, persistent tiredness and weakness. 7. Nausea and vomiting. Occasionally, these gastrointestinal symptoms can occur, but they are less common. In severe cases, chikungunya can lead to complications such as neurological disorders, cardiovascular problems, and hemorrhagic manifestations, though these are rare. The joint pain can last for weeks or even months, leading to long-term disability in some individuals. Transmission cycle: chikungunya is primarily spread by Aedes mosquitoes, which are active during the day, with peak periods early in the morning and late afternoon. The virus enters the human body when an infected mosquito bites and injects the virus into the bloodstream. After the mosquito has fed on an infected person, it can transmit the virus to other humans through subsequent bites. The mosquito-human mosquito cycle of transmission is the main route of spread, and the Aedes mosquitoes are capable of carrying both chikungunya and dengue virus, which sometimes leads to co-infection, complicating the diagnosis and treatment. Diagnosis: diagnosing chikungunya requires a combination of clinical presentation and laboratory tests. In regions where the disease is endemic, healthcare providers may suspect the disease based on a patient's symptoms: fever, rash, and joint pain. Laboratory tests such as RT-PCR, reverse transcription polymerase chain reaction, serology tests IgM and IgG, and virus isolation can confirm the diagnosis. However, because the symptoms of chikungunya can resemble those of other mosquito-borne diseases, such as dengue and Zika, accurate testing is necessary. Treatment: there is no specific antiviral treatment for chikungunya. Management of the disease primarily involves symptomatic relief, including pain relievers, nonsteroidal anti-inflammatory drugs, and Aedes, such as ibuprofen, can help reduce fever and pain. However, aspirin should be avoided due to its association with bleeding complications. Antihistamines for itching associated with the rash. Hydration, ensuring proper fluid intake to avoid dehydration due to fever. Rest, to aid recovery and reduce the strain on the body, particularly with severe joint pain. Prevention: since there is no specific treatment or vaccine available for chikungunya, prevention is primarily focused on avoiding mosquito bites and controlling mosquito populations. Strategies include 1. Mosquito control: reducing mosquito breeding sites by eliminating stagnant water where mosquitoes lay eggs, for example, in containers, tires, and puddles. 2. Use of repellents: applying insect repellents containing DEET or picaridin on exposed skin. 3. Protective clothing: wearing long-sleeved shirts, long pants, and using bed nets or mosquito screens, especially during peak mosquito activity times. 4. Insecticide-treated materials. Using mosquito nets or other treated materials in areas where chikungunya is common. 5. Community awareness and health campaigns, educating the public about mosquito control and protection measures. Epidemiology. Chikungunya was first identified during an outbreak in Tanzania in 1952, and it remained largely confined to Africa and Asia until the 2000s, when large outbreaks were reported in the Indian Ocean region, the Caribbean, and the Americas. In recent years, the spread of Aedes mosquitoes, particularly due to global travel and urbanization, has contributed to the increasing global burden of the disease. The World Health Organization, who continues to monitor chikungunya outbreaks. Long-term effects. While most patients recover within weeks, some individuals may experience persistent joint pain or arthritis for months after the acute phase. This can lead to chronic disability, which significantly impacts quality of life. The long-term pain and discomfort can result in long-lasting physical limitations, and in rare cases, it can become a chronic condition requiring ongoing medical attention. Conclusion: Chikungunya is a debilitating disease that can significantly affect public health in regions where Aedes mosquitoes are prevalent. Although most cases are self-limiting, the intense joint pain and long-term complications in some individuals make it a significant concern. Prevention through mosquito control and personal protection measures remains the best strategy, as there is no specific treatment available. Ongoing research into vaccines and better treatment options is crucial for managing future outbreaks and reducing the global burden of this disease. Thank you for watching my video. Please subscribe my channel.